our first sex class. I'm going to talk about a few topics in our sex classes. I want to start with this one that's so intriguing, the Oedipus and Electra complex. You guys heard that back in the day when you were in school, right? The Oedipus and Electra complex. The Oedipus complex is really, really common, right? Sigmund Freud, back in the 19th century, 20th century, he came up with this idea, and I really, really cannot believe how it is connected to our sexual experiences to the current day. And that's why I want to bring it up with you guys, okay? So, the Oedipus complex is actually when a young boy, right, has some sort of sexual attitude towards the mother and hostility towards the father. Okay? So there's something that happens when they're young, at a certain age, where they go through this phase of liking the mother. We all know about this, and disliking the father. Now, the Oedipus word comes from a Greek myth, right, that he picked up, I guess, from the mythologies of Greece. And what happened was that this young man killed his father and married his mother. And that's where he got that name from, the Oedipus complex. And I tell you that Sigmund Freud, who I'll tell you right now, very controversial, a lot of studies out there that support and, not support him. So I'll say that I am giving it to you as a connection that might be relevant. And then again, it might not be because a lot of people dispel it and don't think it's true. But personally, I think there is some truth in it. I believe that this guy, Sigmund Freud, actually had some great points. And I want to sort of bring them out to you today and show the connection between how we are developing as young kids into adults and how it can actually affect our sexual function. So the Oedipus complex, again, is where the young boy goes through that phase, and how it's handled is critical. How he goes through that phase is going to determine how he develops as a young man sexually. And the Electra complex is where the female, the daughter, is in competition with the mother for the attention of the father. So there she is trying to get the father's attention and is upset the mother's in the way. Now, I know those that are parents that have had kids probably have an idea of some of this stuff when they look back. And I don't know whether you can go back to when you were a child, but I'm sure when we were kids, we went through that too, to some degree. Again, this is sort of controversial. Some people do not agree with his theory, but I tell you that some of his information resonates with me, and I want you to listen to find out why. Okay? And when you see that the Oedipus and the Electra complex are pretty similar, opposite, right? But you'll find that the Electra complex in the woman is much more severe, meaning the woman or the child that is going to develop into a woman, it can have more of an impact and a negative impact on her sexual development as she grows older compared to the young boy that gets into a manhood, because he's not as it's not as intense, it's not as strict in terms of the consequences of what happens to him versus her as she grows up. So again, the connection is that certain things happen in certain families because of that relationship, because of that complex. So if you go back into your history or look at your children and think of the time when there was maybe, that age of 2, 3, they say between 3 and 6, they were developing and they had that temper tantrum, or they wanted to get attention from dad or from mom, depending on whether it's a boy or a girl. You'll find that sometimes if it's not handled well, there are consequences in their late adulthood. I want to show you how. Okay. So the stages, psychosexual stages that Dr. Sigmund Freud came up with are 5. 1, 2, 3, 4, 5. We have the oral stage, the anal stage, the phallic stage, the latency stage, and the genital stage. Now, these are stages that he believes that we go through, right, as young babies. And we actually have a focus sexually, and when he says sexually, he's not saying sexually like adult sex. He's meaning more in terms of pleasure. He says that when we have different stages as we grow, we are going through different erogenous zones. That means different areas that we're focusing on. And these areas, you have to go through these areas to go to the next area and go to the next area to grow as a young child or young baby to a child to an adult. So I'll say it again. There are erogenous zones, areas in our body that, according to Sigmund Freud, we have to have certain experiences with, right? And he likes to say sexual experiences because it's more of a pleasure, right? That we, as young babies, unbeknownst to us, have and go through. And if we're not handled properly, there can be consequences, okay? And that's what I'm trying to point out to you. These developmental stages are important for us to develop healthy relationships in the future. So if we're not developing healthy relationships in the future, it might be because we didn't go through these phases properly. We got stuck somewhere. And then it starts to manifest as an adult in different ways, which I'm going to point out to you, okay? So I'm not going to go into too much detail, but I want you to see that it's important to be there for these children, right? And it's important to allow them to grow and develop as healthy as they can, meaning as well as you can do it. If you can do it well, you do it well. If you do it poorly, they are going to suffer growing up into adulthood, okay? So here we go. The first stage, the oral stage. That oral stage is between birth, 0 to 1 year or 18 months. Now, this is when their mouth is the focus, right? So all these babies think about is food, 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 suck, 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 swallow, 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 right? And get that nipple, get that breast. So that is what this stage is all about, being able to get food or not get food. So again, according to Sigmund Freud, he says if you don't get food, you will not be able to trust people and you will not be able to be dependable because you're going to want to be more selfish and more aggressive and getting things for yourself. Because at that stage, if you got stuck and you were in a situation where you were not fed properly, and we do know there's situations that can happen, they're saying that there is a correlation to you growing up and not being trusting and not being independent, right? You become very dependent and you're always suspicious. So that is where not getting food as a baby can impact you as you grow up into adulthood and you get stuck there. Getting too much food can make you aggressive and dominating, right? And getting too much food, they say, can actually make you eat, overeat, bite your nails, right? Talk a lot. Okay. So it's very important to also not overdo it. So you want to have a balance like everything in life. So you get too much food, become aggressive and dominating. You get too little food, you have trusting issues, and you're not very independent. So that is the interesting thing. So if you're finding yourself in a relationship with somebody that's having issues, I wonder if they were fed as babies. And you really, really should take home the message here, which is how did your partner grow up? How did you grow up? Was it messed up? Was it healthy? And if it was, you're going to be healthier in terms of relationships. But if it was messed up, you're going to have issues. So I want to pinpoint some of the areas where if you go back and you can think how you were brought up or how you bring up your kids, be careful because you don't want to repeat the mistakes that you had done to you. You want to improve it and you want to make sure that your children don't go through that so they can have a better chance of having a healthy relationship than even we did. All right, that's the game point here. So you want to make sure at that early stage between 0 and 1 year, 18 months, right? We're getting to the terrible twos there, right? So you want to make sure that they're getting from that oral phase the food they need because they need that attention whenever they need it. Just give it to them, right? So that they're happy. But you don't want to overfeed and make them obese or make them overweight. You want to give them a good balance. The next phase, which you remember, I said you have to transition into the next phase, right? So by the age of 1 to 3, they're focusing on the anal stage. And that is where they are pooping and they are trying to get potty trained, right? So that age, the terrible twos is there too. I know that. The temper tantrums. I've got a granddaughter who is, woo, testing me, but she's a darling. But you have to realize that this is a very important stage. So you don't want to be overly strict when it comes to their potty training. Because if you're overly strict, guess what happens? They become tidy, mean, stubborn, and OCD. They are very, very, very clean. They don't want things out of place because when they were potty trained and they had to force themselves to have the bowel movements in the potty because the parent or the guardian was very strict, then you don't realize the impact you're having on these poor kids. These kids actually grow up mean and get this, tiny, because guess what? They're holding their stools. And so they're not actually giving out these bowel movements the way they should because of some sort of fear or some sort of argument they're having within themselves or with the parent or the caregiver. So that struggling, that being mean or that being strict during potty training is that anal stage where the child between 1 and 3, if you are not kind, if you are not patient, can grow up and be stubborn and mean and really obsessed with cleanliness. And you really want to make sure that that doesn't happen because if they're overly clean, you're not going to be able to live with anybody because we don't want people that are overly clean. We want clean within a reason. We don't want you OCD. And that is something, again, connected, according to Dr. Freud, where you can actually see that there's some result because of the anal stage of a child's upbringing. Okay. Look at yourself too. How were you brought up? Do you remember? Probably not. Can you ask your family, your parents, your guardian? Yes, go ahead. But again, this is going to not be something that's proven in science. And I know that people will say, oh, why am I talking about this? Again, because I see a connection between how our relationships can be affected by how a person was brought up. And that's exactly why I'm bringing this topic in today to talk to you about this. Okay. So when in the anal stage, it's lax, that means they can just poop all over the place. They can do whatever they want to do when they're potty trained. You'll find that they are untidy and overly generous. And they, again, talk too much and they just give because that's what they did. They just let the poop come out and they just found a way of just being free. Okay. And again, this is what was his opinion in terms of the anal stage and having that experience of being lax in terms of not being strict with the potty training. So remember, you always want to balance. The phallic stage. This is a very important stage. That is where the Oedipus and the Electra complex come in between 3 to 6 years old. So again, this is a very, very important stage because this is actually where, if you remember my talk from before, masturbation actually can start between 3 and 6. They're playing with their genitals. They actually think that there's something there. They start to recognize it. And I did not realize that they actually are able to identify some of these organs, but they really are beginning to, question what these things are. And they're actually toying with themselves, not with anybody else, but with themselves, because they're trying to figure out what that is. So remember, between 3 and 6 years old, don't go crazy. I had one person tell me that she threw a hot towel on her son because at 4 years old, he was having an erection. And I said, no, don't do that because you will hurt and burn the child, and the child will be scarred for life and feel that there's something wrong with his genitals and that it's a bad thing. So you don't do that. That age between 3 and 6, they're not having sexual, fantasies. All they're doing is reflexly trying to find out what their organs are like. And that is the phallic stage that Dr. Freud talks about. Now remember, if they have a bad experience, he says they can have vanity, they can grow with envy, they can grow up with anxiousness and be feel inferior and even be self-obsessed. There's like they're so um, uh, focused on themselves because they didn't get a chance to freely love themselves. So they're taught not to touch themselves. They're taught not to do anything in terms of masturbation. Again, if a child is seen like that, they're reprimanded. And the most important thing you can do is just sit down and gently talk with the child and make sure the child understands that it's okay. Not that you're going to start smacking the child or hurting the child, because the child is not thinking sexually. The child is just inquisitive, trying to again to find out what he or she has as part of a body part. Okay, so again, this can affect the upbringing. If they have good parents, then you're going to find that at the phallic stage, they're going to grow up a lot more confident sexually, and they're going to grow up a lot more open and willing to be in a healthy relationship and open and have a better communication. And that is what we want to have in that phallic stage. So again, when you're in that phallic stage, dealing with either with your child or grandchild, or even thinking about yourself, what happened to you at that age, that might be the reason why you are not having good relationships with your partner, because at this age, 3 to 6, you were inhibited. You were not allowed to be free to enjoy or discover or find out what your body was like or is like, again, depending on who we're talking about. But this is the stage of the Oedipus complex and the Electra complex also. So we have to remember that that is coming into play where the daughter is competing with the mother, or the son is trying to have some sort of sexual, you know, attitude with the mother. But again, nothing happens. What should happen is that they have good family balance, and the father and the mother should be able to easily handle it and teach the child to calm down and to follow as a role model. If it's a boy, the father. So that's what your game plan is for that young boy, to not start going crazy and in a situation where something happens and something silly happens with the mother that should not have happened. You want a healthy balance where the child is spoken to and gently corrected and told this is not appropriate if that happens in your family, and you just let them know consistently that you have to be more of a role model and be an example for the child, so the child can now emulate you and be more like a male role model, right? So if the father is a good male, you want him to be a good male, because if the father's not a good male, the child can turn out to be follow his footsteps and actually have problems as an adult. So you, again, these are the stages where you want the child to learn the right thing, not the wrong thing. Otherwise, it will affect them for the rest of their life. Same thing with the daughter, right? So you want the daughter to become aware that this is not a competition, right, Mom? Because your role as a mother, or our mothers as a role to us, was to give us that confidence that she loved us, even though we were being silly trying to get the father's attention. We didn't know that. But again, these are stages we've got to go through. These are normal stages that we've got to go through. And we do see some commonality in this. We do see this because we have children and we've been through it ourselves. So we know sometimes that things have happened in our childhood that might trigger and say, oh my gosh, that might have happened to you, right? So very important to understand it did impact you. And you've got to sort of like agree that if it did, to get some help, especially if it's impacting you now and affecting your relationships currently, okay? So that phallic stage is very, very important. So you want to have good parenting then. You don't want to have a disagreement with the kids. You want an attachment, right? Because we have different attachments, right? We know the different attachments style. And if you have an avoidant or a type of attachment that needs help, please again reach out to a psychologist or psychiatrist and get some help, because this is something that is deep-seated and may go all the way back to when you were very, very young. Okay. All right. So the latency stage is when between 6 years and puberty. So puberty is between about 9 and 13, or 8 and 13 in the girls, and 9 and 14 in the boys, right? So this is where the hormones are kicking in, and it's younger now than when I was a kid, but the hormones are kicking in. They're becoming more aware of their body changes. Their voice gets deeper. The girls are getting boobs, and some of them are even getting menstrual cycles. So this is that latency phase, and they say here sex is not on the agenda. So they're not really focusing on sex. They're really focusing on social skills, that age between 6 and puberty, school, making friends, hobbies, and just being social. So that is a very important stage of its own, right? Because if you don't get the social skills, if you don't get to go out and maybe go on vacations and have, sleepovers and stuff like that, right? That between 6 and puberty, you might not be able to have, again, a good, healthy relationship, sexually or otherwise, right? So if you see here, it says you become insecure if you don't have that great relationship growing up between 6 and puberty, right? You become insecure, you become isolated, you're sort of like incompetent, you don't know how to behave, you're awkward, you're an introvert, all because you didn't have a great latency stage where you learned how to interact with people and how to just be, have a conversation with people. This again can affect you as an adult. So go back and find out, was this something that happened to you? Because if it is, I want you to address it so that you can be a better person today by getting some help. Again, starting with a psychologist or psychiatrist, okay? I'm not a psychologist or psychiatrist. I'm just linking this to the sexual function or dysfunction that we can have. Remember, I want that orgasm, and I want to know, is this playing a role in why one cannot have an orgasm? And if it is, I want it to be addressed, okay? The last stage is the genital stage, from puberty to adult. All right. So this is where now we're focusing on sexual activity. We're focusing on the other heterosexual partner, the person that you're attracted to, not yourself, because in that phallic stage it was more me, and you. But now in the genital stage, you're now becoming now an adult, from puberty to an adult, and this is crucial again in terms of development, to find out whether you are going to be a productive adult and able to handle relationships. Otherwise, you are going to be, according to this, if you're unhealthy, you don't have a great stage here where you're not suffering and you're not being cold, and hopefully you have parents and you're able to go into a relationship and have a great relationship. If you go into a relationship and you have a horrible experience, this is going to scar you again for the rest of your life. So you're going to have even sexual perversion, which can happen if you get exposed to someone that is horrible. And I please pray that you get help if you have been. But we don't want that to happen. We want to protect our kids and protect our young adults and protect all of us at all time. So please understand, if that happened to you, you do want to get some help and speak to some professional, okay? So that can lead to sexual perversion. That can lead to sexual dysfunction, especially with the guys that are always worried about performance, right? Performance anxiety. They say that comes from here. When you have that stage, the genital stage, where you really didn't have a lot of confidence. You didn't really have a relationship that they could say, was beautiful and pleasurable. So you really want to have a relationship where you have a great experience, because if you don't, this can affect you in the future. So when you have a healthy relationship, you've got some balance, you're emotionally stable, you're romantic, you're able to have healthy relationships. And that is what I want for us all, which is why I wanted to bring this topic up. I want you to know that if any of these stages were defective, if you had problems, and I know we're not perfect, I know we can't really go back and change what happened to us, but you can address it. You can go back and say, so this is what happened to me, and this is why I'm like this. This is what I'm going to do to correct it. And that is all I wanted to do today, to connect the dots for you to know there might be something that happened to you in your childhood that might have made you be what you are now, but you can correct it and become a better you in your relationships. Okay? All right, guys. I said I'll let you know about that. I'll talk to you tomorrow. Have a great night. Bye.